Okay, we all set? Great. Welcome, everyone. My name is James Robinsky, and I'm the director of the Dahdaleh Institute for Global Health Research here at York University. And I'm very proud today to introduce and to host the 5th annual Global Health Intern Symposium. And here we are featuring exceptional students who are going to be showcasing their contributions to global health research over the last year here at the Dahdaleh Institute. And it's very much a celebration of their journey, of the work that they've done over the year, and the progress and development that they've made over the year, so that they can become very much the next generation of global health leaders and researchers and practitioners. And for me personally, this is always just one of the best symposia of the year, and I always just love to see how much students have learned and grown over the year, and it's a very, very, I guess the word is probably gratifying kind of time for all of the work that people put into creating the Institute, that put to making it function in a reasonable way, and most especially Teresa, who essentially runs the Institute and who is the key person on so many fronts, but the key person especially for student support and student engagement. And I would just say that nothing would happen without Teresa's just incredible commitment and support. So at the very beginning, I'd like to say that, thank you, Teresa. And this is also a very much a kind of a marker of our sort of collective success. So Teresa is very much a part of that. Now, before we go into the actual symposia, I'd just like to begin with a land acknowledgement. And this is a virtual event. And so some people are on different physical territories. So please do take the time and the space to give thanks and gratitude and respect to the land that you're physically on and that you're physically living and working on. And today, we're here at York University campus in Toronto, and York University is situated on the traditional territorial area that's known as Takaranto, and we acknowledge its current treaty holders, which are the Mississaugas of the Credit First Nation. We also acknowledge that this is the traditional territory of many Indigenous nations, which include the Anishinaabeg Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and of course the Métis. And this territory is subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peaceably share and care for the Great Lakes region. And now with that acknowledgement of the territory that we're on, I'd just like to also just say that the symposium today is a kind of a capstone, if you will, of the Global Health Internship Program. And in that program, students apply critical research skills, and they pursue meaningful research opportunities under the guidance of leading global health researchers here at York. And the Dahdaleh Institute here, as you now have learned, we use a critical problem-solving approach to pursue greater effectiveness, which is always the first and most important criteria. Whatever we do has to work. So we use a critical problem-solving approach to pursue effectiveness. Also, equity. And our major focus is on the most vulnerable people in the world. And we try always, through all of our research, to, in the first instance, make sure that our research focuses on the needs of the most vulnerable people. And from there, to kind of offer a little play on words, we hope there's a trickle-up effect, so that the innovations that we are involved in creating, that they then move into the center of society. But in the first instance, our goal is to really improve the health and well-being of the most vulnerable people in the world. And then the other big principle that we apply when we think about critical problem solving is excellence. We do not broach in any way double standards, and we do not broach in any way mediocrity, and acceptance of the less than what we can imagine to be perfect and the good. So excellence is a drive that is just so fundamental to all that we do. And so with that, we try at the Institute to kind of model that and to encourage people to fall into that approach, critical problem solving for greater effectiveness, equity, and excellence on global health. And we work very much at the interface between policy and practice to address major issues of the 21st century. And we use in the Global Health Interns program an experiential educational approach. And we hope these are dynamic opportunities for students to work with faculty and fellows. And in a highly professional environment where there is a commitment to excellence, and also to support extremely high caliber research in the areas of our current themes. And our themes are planetary health, global health and humanitarianism, and global health foresighting. And interns over the year have been engaged in a variety of activities, literature reviews, data synthesis. I can never say that word correctly. I always get a little tongue-tied, but anyway. Cataloging, content development, stakeholder engagement, and many, many more activities, which we're going to hear a little bit about today. We've got a great lineup, but some of our interns aren't available today for various reasons, exams, personal obligations, but I would like to take a moment to recognize all the wonderful work that the interns have contributed to over the year. And some interns have submitted video recordings that can be found on the Dahdaleh Institute website. So today is a showcase of this year's cohort's very hard work, and each intern will describe what they did and what they learned and the major tasks that they carried out. They'll also share how their work has contributed toward research that addresses critical global health challenges. And some of the topics that will be discussed are social inequalities in health, the protocol for international policymaking, and many global health projects in design, communication, lending library, and sub-website development. We hope these presentations can also inspire other students and faculty to participate in the Institute's Global Health Intern Program. For prospective interns or people who want to or are thinking about joining the Institute, there are many upcoming opportunities, and they're posted on the website under the Global Health Internship Program page. So you can go there. You can also sign up for our newsletter. Now, specifically, we're recruiting 11 part-time positions for the summer. 11 part-time global health interns, and these are in many different areas, but just to give you a flavor, assistive AR prompting, social science and health innovations for TB or tuberculosis, global health legal epidemiology, wellness, global health wellness and self-care, and many, many more areas. The deadline is April 20. Which I believe is tomorrow. So please do take a look and get your application in. Just housekeeping. This is a 2-hour seminar, or symposium, I should say. And we're going to start with the first 4 presentations. And we'll have a brief Q&A and discussion after. Then we're going to take about a 10-minute, we are taking a strict 10-minute break, I believe, strict being the operative word, at 11:50. And we'll resume at 12 for the remaining 4 presentations, and we'll have another round of Q&A, and then we'll be wrapping up at 1. On the bottom of your screen, for those who are online, please use your raised hand button if you want to ask a question or engage in discussion, and otherwise please mute your microphone unless you're speaking or engaged in discussion. So let's start with the first 4 presentations. and then we'll take some questions after the first 4 presentations. And our first presenter is the esteemed Michelle Tieu. And Michelle has been working with me, with Professor Shetal Desai and Professor Angela Norwood at the design department. And she has been working with us to explore the collaboration between global health and design. And she has been and remains, as far as I'm aware, the principal coordinator for the quote-unquote Massive Action Global Health Design Seminar Series. And this was a series that we've just completed with the world-renowned designer Bruce Mal and his equally renowned partner, B.C. Williams. The title of Michelle's presentation is Global Health Design Seminar Series with Bruce Mal. Over to you, Michelle.
Should I switch the camera first? So, hello everyone in the room and online. My name is Michelle, and I am a Global Health, it's a really long title, Dissemination and Design Research Assistant. I've been at the Institute since the beginning of the fall semester. I am a third-year honors Bachelor of Design undergraduate student. I was originally hired to design the annual report for the Institute to mark the past 5 years of progress, but my role pivoted as I became involved in coordinating the Massive Action Global Health Design Seminar Series with Bruce Mal and B.C. Williams from the Massive Change Network, which is their company and design studio. So this 6-part series was hosted monthly from November 2022 until April 2023. I am incredibly grateful to my supervisor, Dr. James Orzinski, Dahdaleh colleagues Shauna, Teresa, Armando, Fernando, Hannah, Professors Dr. Shetal Desai and Angela Norwood, and Bruce and BC for such an amazing opportunity. So I can get into what I actually did. So what I did with the seminar series was the seminar series directions and outputs, the promotions and registrations along with Yashini, and coordinating preliminary meetings and connecting students and researchers. So for my lead role as the coordinator on the series, I worked very closely with James, Shauna, Teresa, Shetal, all the names, Angela, Bruce, and BC to develop the seminar series directions and outputs. So in the beginning, it was a very kind of flexible, ongoing process, lots of meetings. So we were really able to kind of go through and kind of think about what we wanted for the series, and that was very cool, kind of watching it grow. There were 4 case studies led respectively by Dr. Kate Tilachek, Dr. Mary Wiktorowicz, Dr. Imran Ali, and Dr. Jude Khan. So behind the scenes, work included setting up the seminar series website with fellow intern Yashini, promoting the series across platforms including email lists, social media, and our website, which is on the right. The thing on the left, the Airtable, was very crazy, very big part of the coordination process. And yeah, once the website was complete, we worked closely with the research teams on each of the case studies, and I coordinated these preliminary meetings, such as the scenarios workshop between all the design students and Bruce, and also individual meetings between each research team and their respective students to really kind of figure out what they wanted out of each case study and what kind of solutions they were kind of looking for. Or not looking for, but directions. So then what I learned from there was, that's me with Jude. So what I learned from there was first, the amazing opportunities in global health and the ability to cross-collaborate. Working at the Institute really opened my eyes to the amazing world of research and global health. In high school, I was into science. I did it up to grade 11, I think, but then I never pursued it and decided to do a more arts-focused degree. But this really gave me an opportunity to learn about healthcare and the wide-stemming issues in global health, from epidemiology to climate change and other pressing factors. So as a design student, I learned so much from how all the research teams conducted their research studies, just reading all of their papers, and how they explained their case studies and projects to the students. It was incredibly rewarding watching all the scenarios and design outputs from each of the case studies and seeing how design's integration into science can foster new creative solutions to global problems. Number 2, the importance of communication and emails and the asynchronous agenda that James loves. So being able to coordinate between the team with meeting minutes and agendas helps everyone stay on track of our action tasks and coordinate everything effectively. Also, flexibility. Coordinating this series taught me how to be flexible and work on the go. I was able to adapt to different changes proposed to members of the committee, the planning committee, research team members, or feedback from the students. So as we're going along, we're able to go and change things with each seminar, which made it better. And then here's a great photo from the final seminar. Where I just think it sums it up perfectly. It was so great. Everyone learned so much. So finally, for next steps, for me, this summer I will be at Identos, which is a healthcare and data management startup. They have developed a way for patients to share their healthcare information across very siloed areas in health in Ontario, so such as your family doctor, hospitals, dentists. As a patient now, you have more control over your data, so that's kind of their proprietary technology. I believe my experience working with all of the research teams in this process, especially as a case study presenter for Dr. Jude Kong for AI for PEP, allowed me to gain relevant experience in the health space that I can apply now to working at Identos, which is fantastic and totally unplanned. And working with all of my colleagues at the Institute showed me how hard work and ingenuity can bring me forward in life. Talking to Teresa, talking to Sean, everyone's backgrounds are so different, but it showed me how hard work and these different life experiences can apply now to the overall goals at the Institute. So in my fourth year, I'll be doing my graduate exhibit. This is this year's logo, so ignore that, but an example of the design showcase. And I'll be graduating June next year. With that being said, I would like to thank James, Shauna, Teresa, Fernando, and Hannah, everyone at the Institute for shaping my time here and providing a fulfilling work-study experience that has strengthened my communication, organization, and time management skills. So thank you, and you can keep up with me there if you would like. But yeah, that's it.
That's great. Thank you so much, Michelle. I have lots of thoughts and questions, but let's go through the presentations, and then we'll come back to reflection. So thanks for a great presentation, Michelle. Our second presenter is Gurher Sidhu, and Gurher is working also with me, and she has assisted and has been and continues to assist in writing and the production of the EcoSalud partnership between the Dahdaleh Institute and several researchers in Costa Rica. This has been led by Professor Martin Bunch, and a whole series. He's the primary principal investigator, and a whole series of professors here at York, at the Kiel campus, but also at York in Costa Rica, and also at many different universities in Costa Rica and community partners. So, Gurher, over to you.
Hi, everyone. Can you hear me all right?
Yes, very nice. Go ahead, Gurher.
Okay, perfect. So hi, everyone. My name is Gurher, and my presentation is entitled Supporting the Institute and EcoSalud Project. So originally I was hired in order to assist in the writing of a promotional publication for the Institute, and to this effect I helped, alongside with Michelle and Shauna, develop a list of possible narratives that would best encompass the vision, mission, and overall spirit of the Institute. And we also brainstormed a list of potential feature stories for the same reason. Unfortunately, that project was put on hold for the time being, and so I was delegated to alternate tasks, such as recap writing. And so some of the main ones I covered included the recent self-care and wellness series run by Harvey Skinner and Susan Harris. And probably my favorite one to cover among all of the ones I did was the Bruce Mao's Massive Action Seminar, which Michelle beautifully described. And finally, I helped in a lot of grant assistance work. So the EcoSalud project, which is to build capacity in community partners to understand the climate drivers of environmental change and improve and well-being in southern Costa Rica, just to summarize it. I assisted in the Shirka grant application for that. And there is a shocking amount of administrative work that is required in such a process. And so the administrative work included updating team descriptions, taking notes, portal assistance, sending email reminders. It's a pretty complicated process, and I learned a lot in the process as well. And finally, I also helped in editing the draft, which wasn't just, grammatical work. It was a lot of shortening because we had a lot to say about the topic, but only so much space is allotted in a project description for a SHIRT grant. And so what did I learn? I learned to write succinctly. I love writing. I love creative writing and describing things in very flowery fashion, but that honestly doesn't always fly in a research capacity. So I definitely learned a lot of that, whether it was through writing the recaps or in the grant assistance work I did. I also learned the degree of administrative work that is required in not only specific research projects, but an overall organization, as I'm sure Teresa, Hannah, and everyone can attest to. And finally, by attending various seminars throughout the year, whether it was in person, online, whether I had to write a recap for it or not, I discovered that there are so many potential research interests that go beyond what a layperson would think global health involves. So for example, I really enjoyed Dr. Khalid's presentation about the importance of short summaries in global health research with the Red Cross, Dr. Arun Chokalingham's description about communicable diseases and all of that. There's so many more, but I'll leave it at that. And so what's next for me? This summer, I will either be working as a policy intern at OHIP through the Exceptional Access Program, in which we approve or reject applications for very, very costly and life-saving medications, or another rate position, which I have applied for. And I'm very happy to say that in July, I will be taking a course at the Las Nubes Eco Campus in Costa Rica, which is actually what the EcoSalud project is centered around. And so this effect, I will be practicing my Spanish. And finally, in September, I will be entering my 4th year of the Global Health Bachelor of Science, where I hope to take on an independent study at some point, and also definitely another rate position. And so I wanted to say thank you to everyone who has helped me, including Teresa, Hannah, Shauna, and Dr. James Arbinsky. This has been a great experience for me, and thank you for listening to my presentation.
That was great. Wow, that was terrific. I have, again, a billion questions. I will feel my lips and enthusiasm, and we'll go to the next presenter, but I will have a question or two for you, Gurher, in a moment. Our next presenter is Gabriel Fezza, and Gabriel is working with Professor Mathieu Poirier at the Global Strategy Lab to support the lab's approach to antimicrobial resistance policy. And the title of Gabriel's presentation today is Lessons from the Montreal Protocol for International Policymaking. And with that, over to you, Gabriel.
Thank you so much. Do we want to shift? Amazing. Thank you, Dr. Urbinsky, for chairing this event, and really thank you to everyone involved in putting this all together and to everyone who's attending. I'd also like to take a moment to thank my supervisors, Dr. Poirier and Dr. Rogers Van Cadwick, for all their support and guidance throughout the last 7 months, and really all of the amazing people at the Global Strategy Lab that I've had the opportunity to work with and learn from throughout the course of my internship. And so as a research assistant with the Global Strategy Lab, I've had the opportunity to participate in sort of 2 aspects of the research going on at GSL, and they are antimicrobial resistance policy acceleration stream and the global legal epidemiology stream. Over the course of my internship, I've had the opportunity to work on a number of different projects. Here, I'm just going to highlight a couple of the recent projects I've been participating in. So for AMR policy acceleration, I've been conducting literature searches for a project on unifying global targets on antimicrobial resistance and use. And those literature searches look at country-level data on the use of antibiotics and medically important antibiotics in human medicine in the agri-food system, as well as looking at data on the access use of antibiotics in the access versus watch and reserve categories for antibiotics. And alongside those literature searches, we've also been trying to find any efforts that have been put forward to reduce the use of antibiotics and shift prescription habits from watch and reserve antibiotics to access class antibiotics. For my some of the responsibilities that I have in the global legal epidemiology stream, I've also conducted some literature searches and supported manuscript development for a commentary on the lessons from the Montreal Protocol for effective international policymaking. And the literature searches for this project looked at the Montreal Protocol's negotiation phase, treaty design, and implementation to try and find the effective features that resulted in the protocol's success. And I'll talk a little bit more about this in sort of the context of what I've learned. So the Montreal Protocol is an international environmental treaty for substances that deplete the ozone layer. These substances are called chlorofluorocarbons, or CFCs. And the Montreal Protocol was finalized in 1987. And since then, it has achieved complete ratification, making it the only environmental treaty to sort of achieve that level of success. And because of that, it really highlights the universal acceptance and success of the protocol as a landmark agreement. In our review of the literature, we've highlighted a number of themes that have summarized the effective features of the protocol. In the interest of time, I'm only going to highlight one of the three. But as far as the theme of equity, we've noticed that the negotiation phase of the protocol, there was a lot of efforts made to include developing countries throughout the negotiations. And this was a really important factor in the later development of the multilateral fund, which was an important mechanism in distributing resources to developing countries in order to assist them and support them in transitioning away from CFCs to more sustainable chemicals. On top of that, the Montreal Protocol utilized a very interesting and unique compliance model that offered low resource countries a 10-year leeway period to reach the CFC reduction requirements in the Montreal Protocol. And sort of the second part of this manuscript is looking at what are the lessons that we've learned from the Montreal Protocol and how can we apply this to international policy for antimicrobial resistance. And although this manuscript is still under development, a few of the things that we're thinking about are including similar participatory approaches that involve developing countries and similar funding and technological innovation to support WASH programs, antibiotic alternatives, and knowledge sharing. And finally, similar flexibility and compliance with AMR policy goals based on country-level capacity and sort of other factors. And so finally, I'm really hoping to continue supporting research and developing my skills. I'm looking forward to doing my global health practicum next winter. I'm hoping it's going to be something research intensive. And beyond that, I'm going to be applying to graduate schools and other professional programs. And we'll sort of see where my path goes from there. But thank you, everyone, for listening.
That's great. Thank you so much, guys. Again, lots of questions, but we'll get there. So thank you so much for that. That was great. Our fourth presenter this morning is Georgina Birago. Forgive me if I bastardized the name. Georgina Birago Odoom. I hope I did that correctly, Georgina. And Georgina, thank you. Okay. Georgina is working with Professor Godfred Boateng, who's a new professor here at York and at the Dahdaleh Institute, and who is an incredible researcher and an incredible addition to our community here at York. And Georgina has been working with Professor Boateng to identify the relationship and possible consequences between housing insecurity and health outcomes for people living with HIV. And the title of Georgina's presentation this morning is House Insecurity Among People Living with HIV in Kenya. And with that, Georgina, over to you. Welcome.
Okay. Thank you very much. Hi, everyone. My name is Georgina Birago Odoom, and I'll be presenting to you today on housing insecurity among people living with HIV and AIDS in Kenya. Before I begin, I would like to express my gratitude to the Dahdaleh Institute of Global Health Research for giving me this opportunity to be part of its internship program. Also, I would like to appreciate the effort of the symposium organizers for making today possible, and to my supervisor, Dr. Gurher, for his massive contribution towards this study. The order of my presentation is going to begin with a brief presentation that is going to follow with an introduction. We go through the methodology, findings, and possible conclusions that we have made. Now, the future of sustainable settlements and the effectiveness of homelessness has been attributed to urbanization, globalization, and rural migration, mainly in low and middle income countries. However, in high-income countries, the influx of the aging population have contributed to housing policies that are being set to make people comfortable within their living countries. However, the current housing model in both countries does not account for housing insecurity and health outcomes among people living in the high and middle-income countries. According to our Odoom data, about more than 50% of urban dwellers are living in informal settlements, whilst less than 50% of its population live in rural centers. On this slide, I have made a brief description about Kenya and Canada, looking at high informal settlements in these countries. And it's been considered that over the years, mainly it has transitioned in a part of the global north countries, of which Kenya is part, and roughly about 2.4 billion people reside currently in informal settlements in Kenya. The objective of this study have been grouped into two phases. The first phase, a literature review was being conducted. That is where a synthesis of the literature was done to identify gaps in the various literatures that were available. And in the phase two of the study, we are going to collect data and then analyze the data to know the relation between housing insecurity and health outcomes among people living with HIV and AIDS, and its possible complications on the people with HIV and AIDS. With our methodology section, we identify some keywords that were searched through search engines like Google Scholar, Web of Science, PubMed, OVED, and ProQuest. Now, this following slides, I will highlight on the key information that I gathered from the literature. Now, I realized that housing as a social determinant of health is disproportionately distributed across countries. And this unequal distribution is much wider in low and middle income countries as compared to high income countries. And there are over 1 billion people currently residing in informal settlements in low and middle income countries. And these informal settlements often suffer from conditions such as water supply, sewage and drainage systems, toilet facility and sanitation issues, as well as stable housing as well. Now, as I said earlier, the study depicts that globalization, urbanization, and rural-urban migration were the main contributing factors affecting population density in low and middle-income countries. However, this forces most people to live in slums and informal settlements, brooding much into some social inequalities that were existing between them that has been leading as a result of lack of planning of these settlements, lack of recognition of where they are living, as well as unstable income and unstable tenure. With the health effects of informal settlements, currently nearly about 61% of urban dwellers in Kenya resides in informal settlements. And these proportions are, however, overcrowded to about 5% of its land. The overcrowding has led to some health consequences like diarrhea, infections, diarrhea diseases, respiratory infections, psychosocial health effects, as well as leading to overall poor quality of health. In health effects of housing insecurity on HIV and AIDS population living in Kenya, you realize that there is a current high prevalence in Kenya, and this has been attributed to about 133 per 100,000 population people who annually die out of HIV and AIDS in Kenya. However, our study couldn't really identify much information about how these estimates have been linked to housing insecurity and its impact on the health outcome of HIV and AIDS people living in Kenya. In conclusion, we support Dahdaleh and his colleagues, saying that stable and secure housing is as a result of a linking factor between housing insecurity and the health of individuals. With the existing housing insecurity in Kenya, this study looks forward to measuring housing insecurity among people living with HIV and AIDS and its implication on their health. And we hope that at the end of the study will inform policymakers in restructuring their housing policies to meet the need of the general population as well as Kenyans. And I look forward to learn more in the coming sections of the next academic year to continue and see how this study is going to help the people of Kenyans. Thank you.
That's great, Georgina. That was excellent. I would invite people to raise their hands if they're online and they want to ask a question, or anyone in the room, please feel free, just raise your hand and I'll ask you to pose your question. So with that, I am going to myself ask a couple of questions. So I'm going to ask Georgina. Thank you for that presentation. That was terrific. One of the things that it indicates to me is that what you've done, or what you're in the process of doing with Professor Boateng, is you're actually showing very concretely the relationship between housing insecurity and infectious disease related health outcomes, but also coping strategies. And so you talk about the importance of addressing the societal determinants of health in informal settlements. And what kind of ideas or proposals come to mind for you around better housing? What are some of the infrastructure issues that are relevant to better housing? And I'm just thinking, for example, around safe potable water, proper sewage, proper access to energy for appropriate cooking and heating and so on. So what kind of very practical policy prescriptions come to mind for you, Georgina, after having looked at this literature?
Thank you for your question. Currently, in relation to building good housing policies in Kenya, the UN Habitat, in correlation with the Kenyan Environmental and Housing Department, are coming up. They have actually come up with some policies, of which they are in the process of establishing them, making sure that the huge number of informal settlements in their urban areas are being reduced. They are currently structuring some houses to accommodate people that are suffering from these slums, living in these slums areas. And to me, that is what I have come to as a result of what is happening over there. But this is in the context of the general Kenyan population, but not particularly to people that are suffering from HIV and AIDS. So if the general population is suffering from or living in these informal settlements, how much more people that are not able to get adequate care and adequate treatment as far as their conditions are concerned? So that is what this study is actually gearing towards. Yeah.
That's great. So are there then, just a follow-up question, are there, in your mind at this stage, I know it's very early stage of research and investigation, but are there then very specific things that you might recommend that would help people with HIV living in urban slum settlements to improve their overall health status?
Yeah, in my opinion, since most of them normally suffer from stigma and discrimination, I would advocate to them that they should be of themselves. And if you have a particular skill, you should go out and then seek for employment, try to get something for yourself. And with the support of the community, they should come together to develop a community support, social support for themselves, so that they can come out and get something for themselves to be able to acquire health and then live in a comfortable situation for themselves. That's what I would advocate for them.
That's great. Well, thank you, Georgina. That was a great presentation, and I'm so glad you've had the opportunity to work with Godfred and also here at the Institute. So thank you again for the presentation.
Thank you.
Gabriel, if I could just turn to you, I have a question for you. With the, in looking at AMR, antimicrobial drug resistance, and the approach to policy, the approach to developing a policy, a set of policy prescriptions, right? Let's use that language. You've used the Montreal Protocol as a comparator. So why was that choice made? And what are the points of similarity between the issue of emergent antimicrobial drug resistance and the depletion of the ozone layer, and then the policy process that followed? Why that comparative?
So that's a really great question. Thank you. So both ozone depletion and antimicrobial resistance are what are referred to as challenges of the commons. So, and in particular, a depletion in the ozone layer over one part of the world doesn't just affect that one part of the world, it affects the entire world in the same way that high rates of antimicrobial resistance in one region of the world can have a negative impact on everyone. So I think that as a starting point is a good sort of comparator between the two. I think the other thing is that with ozone depletion and antimicrobial resistance, this really requires global consensus and coordinated action. And so we're trying to pull a lot of these effective elements of the Montreal Protocol and seeing, how can we integrate that into AMR policy, or how can we suggest that AMR policy could be sort of tailored in a way that mobilizes the public and sort of governments and everyone to sort of act in that way.
That's great. And then I would also, I just encourage people to ask questions if they feel compelled to do so. So just raise your hand online or in the room. But I would also, such a great answer. So dealing with the comparator, or the issue is they're both challenges of the global commons. And then the other thing that comes to mind there is that they both have, I would think, very clear, compelling scientific evidence bases, right, that argue definitively that there's an issue. I just ask you to reflect on Georgina's presentation, in fact, and just, are there things that come to mind in terms of policy, in terms of dealing with the emergence of antimicrobial resistance, that might be relevant to the kind of environments that Georgina has just very nicely described? Slums, barrios, squatter settlements that account for 50 to 75% of all people living in urban settings, which now is around 60% of the world's population, right? So that's a huge number of people who are at increased risk of infectious disease because of really egregiously inadequate living and housing circumstances. What kind of policy ideas come to mind for you? I know this is really putting you on the spot.
No, that's a great question.
Because did a great presentation. So go ahead.
That's a great question. So I think that's one of the reasons why we highlighted the multilateral fund in the Montreal Protocol. So tackling antimicrobial resistance is going to be a multifaceted approach. It's not just about telling everyone to reduce their antibiotic consumption. As Georgina had mentioned, there's so many other factors that contribute to the use of antibiotics. That's why WASH programs are very important. And so similar mechanisms need to be put in place to support, regions that aren't equipped, or put a lot of pressure on them to utilize antibiotics. And so I think that's a sort of very strong parallel between the two.
That's great.
Thank you.
Go ahead.
I had a question. As a layperson, kind of knowing like small little bits about like antibiotics and like learning throughout the year, like how do you navigate like making or trying to find ideas for policy when like things are slowly becoming politicized and like anti-science when there's such like a huge background and like like the ozone layer and like the research about that and the research into AMR? Like how do you navigate that?
That's a really interesting point. So one of the things that we noticed when we were looking at the history of the Montreal Protocol is that very early on in its stages, there was a lot of contentions between countries, particularly countries that were responsible for a lot of the CFC production, didn't want to believe the science in ozone depletion. I think we're so much farther ahead in antimicrobial resistance because there really is a sort of a global understanding that this is a very serious problem. And I think in that regard, there's a lot more sort of mobilization of action trying to tackle it and do so in a coordinated way. So thank you. That's a great question, though.
Yeah, thank you. I have a question for, for Gurher. And I thought your presentation was great. If you can come back, there you are. Yeah, I thought your presentation was really terrific, Gurher. And I think the one thing, there's so many things that you said, but the one thing that really struck me as something that was a kind of an insight for you, something that you didn't quite realize before, was just the complexity of administration and the complexity of actually getting that right. Even to support the idea of writing a proposed grant application, never mind actually getting a grant and then actually creating an appropriate administrative structure to support that. Do you want to just talk a little bit about that, about what that was like for you?
Right. So I think the main thing I noticed is that most people who are involved in research are involved in a lot of things. They are overachievers. They do a lot of different projects and things like that. And so to keep everyone organized, it's not really a matter of like whether or not people themselves are responsible. It's just that they have so much going on. And I think the most important thing for me was just using like the right tools. So for example, I was able to use Excel spreadsheets, a lot of them, and then like create different like labels for each stage that everyone is working in, but mainly just keeping in mind that people are very busy and that's what my job is for, to support them in that. Yeah, that was my main observation overall.
Great. And then I was also really happy to hear that you're going to be working or potentially working with OHIP or the Ministry of Health this summer. Just a question on that. Tell us more about the potential role, or what the role will be, and also if you could reflect on how your experience here has helped you or might help you in that future role.
Of course. So there's two sides to the role. One is the more operational project side of the role, where I will be actually answering calls of people who are asking whether or not their medication can be covered. And so that's the more front-facing service side of the role. And there will be like a sort of triage that a triage of questions I'll go through. So, and then eventually come to an answer of yes, your medication will be covered, no, it will not be covered. And then having to deal with the obvious responses that will come with that, the very strong responses, because these are very important medications. And so that's one side of it. The second side of it will be actually involved in policy, so seeing which medications should be covered and kind of the stipulations between like like the different reasons between why medications should be covered and reasons why they might not be covered. So are there alternate treatments that can be administered? What is the chance that this medication will even be successful? And things like very like calculation-based ideas that don't really fly well when someone's thinking about their own health and whether or not they're going to live. It's a very like the juxtaposition of these two things is very like unappealing in many ways, but it's really important work. And so how will the work that I did here apply to that? I think number one, staying organized will be super important in that role, of course, but then also the communication aspect of it, where I talked to a variety of different people, whether it was researchers, other undergrad students, or whatever. I think just communication in any role, like I did here, will apply very well to the future role if I do end up choosing to go with that.
Well, that's great, Gurher. And I will say that from what I've been told and from what I've seen of your work, You've just done outstanding work over the years, so thank you for that. And I wish you the very best at the Ministry of Health this summer, and also for the rest of your program when you come back. Make sure that you're here, that you hang around here somehow.
Will do. Thank you.
And Michelle, I've worked with you, I think, most closely of all of the interns, and it's been a real pleasure, and just to watch you grow, most especially. But can you give some reflection on the relationship between what you thought before around design and global health, and what you think now about the relationship between design and global health? Is there a difference between what you thought before and what you think now?
Yeah, for sure. I definitely think going into it, I was kind of like, oh, that's interesting. Like, I know that, like, design could be applied to multiple disciplines, but I kind of didn't know to what extent we'd be able to design, like, better systems, because I think with a lot of kind of like just what everyone's touching upon, I see some themes of like administration with Gurher's presentation and like other kinds of aspects of research. It's very like a broad system. Like I think we were talking about it a lot during the case studies, how like there's the systems of like the nonprofit organizations and like the people on the ground and like all these and the governments and the policymakers. So kind of like applying the systems thinking from design into that. So it's very transferable in the sense, so even though it's very different from like where we come from in terms of like knowledge, as a knowledge base, the actual design theories are still applicable because it's all based in these different relational elements together. So that was really cool, seeing that like we could actually work together and give insights to the teams that like maybe like they were thinking about but didn't like properly cement or things like that, and also getting their insights into our work as well.
Okay. And then the last question for you, Michelle, can you just offer some reflections on process and the idea of process as part of the design intention?
Yeah, it was very interesting in the beginning how we're like, what's going on? Like, we kind of know, kind of don't know, and things are changing all the time. But I think that's an important part because, like, you're able to, like, grow and really, it's so hard to, like, explain, but it really blossomed into something beautiful by the end. And that's very important, like, part of taking the risk. Like, maybe some of the seminars, like, we're like, oh, no, like, that could have gone a little bit better, but we're able to take from that and, like, apply it to the next one, which is really important because, like, I think being able to take those risks and push yourself even if you fail, but then being able to bring that forward is an important part of being a designer, and also just in general, like growing as a person. So yeah.
Wonderful. Well, so I'd just say thank you to Michelle for a terrific presentation. Also to Gurher, same, wonderful presentation, and Gabriel and Georgina. And I also note that on the chat board, Mathieu Papier has offered his congratulations to everyone, and especially I think to Gabriel. So that's great. And the same with Godfred. Godfred has thanked Georgina especially. So with that, oh, is there a question? Where? Tina, do you have a question? Yes, your hand is up. Go ahead, Tina.
Hello.
Hi, Tina. You're welcome. Please go ahead and ask your question.
Thank you. So I just wanted to say thanks for the presentation. They're really great. And I had a specific question for Georgina. I think I quite enjoyed her presentation, and I just wanted to find out when she talks about the instability in the housing for people living with HIV. I know she doesn't have like the actual findings at the moment, but I wanted to understand what her hypothesis is on the distinction between the housing situation for people living with HIV to those that are not living with HIV, for example, whether they're living in rural areas or not, and also according to the literature that you have done, is it that the situation of housing changes when someone gets HIV, or is it just because maybe it gets exacerbated because of the situation they are in even before they contract the disease? So I just wanted to understand, like, what is the nuance in the differences between those that are not living with HIV to those that are? Thank you.
Yeah, thank you very much for your question. Per the literature, I've found that currently the overall population, the overall Kenyan population, that is about 61%, are currently residing in informal settlements in slums, including both HIV and non-HIV patients. So that is why we have identified that housing insecurity problem is there for the whole population. So this study is now going in to find out, in relation with HIV, people living with HIV and AIDS, how much they are being influenced or affected by housing insecurity and its impact on their health outcome. Yeah.
Interesting. Thank you.
Yeah, and there, I would just add, it's a great question, and that's the next stage, I think, of Gottfried's and Georgina's research. But things like, for example, when you're HIV positive, your immune system doesn't function as well, and so therefore you are much more susceptible to infectious disease exposures. So if you have poor water, poor sanitation, and there's a higher volume of infectious disease agents, you're just that much more susceptible. And if you're living in housing insecure environments, in slums, squatter settlements, and barrios, your access to secure food is already diminished. And if you're unwell and immunocompromised, even the pursuit of food, going out to get food, can be a difficult and challenging to your health and to your overall well-being event. And so there are really important, unique variables, and Gottfried and Georgina will certainly be exploring those. So I'm going to, with that, invite people to take a 10-minute break. It is now 11, let's say we'll be back at 12:05, Teresa? Okay, we'll start back sharply at 12:05, so just a quick break, and we'll see you in a few minutes. Okay.
Hi everyone, my name is Urmi. Before I begin, I want to ask you all a question. Who here checked their email or the weather today? Well, both of those use AI. In fact, AI is all around us. The project I contributed to at the Institute focused specifically on the role of AI in a non-communicable disease prevention policy context. Before I dive into it, I just want to take a minute to thank my supervisor, Dr. Penny, as well as Dr. Asbury for the opportunity, and the Dahdaleh Institute and the symposium coordinators for a chance to share this presentation with you all today. Non-communicable diseases make up 74% of all deaths, making this a very important global health issue. One way to address this is through population health policy, which aims to target an entire population to reduce NCD incidence. Population health policy can be challenging to develop, and this is especially true for NCDs because of their complex etiology. Artificial intelligence, or AI, which is a set of rapidly growing methods that can interpret data and learn from its interpretations, may help support the development of NCD prevention policy that is better able to respond to a complex context. So within this project, we sought to determine two major things. First, how is AI being used to support policy? And second, do authors consider ethics and equity when using AI in this context? My specific role was to contribute to a systematic scoping review, including to assist with drafting a protocol and screening and analyzing data. Well, what did we find? Three major things. First, we found that AI tools are primarily used in high-income countries, which may result in further disparities in the health outcomes between those living in high and lower middle-income countries. Second, we found that AI is largely used as a tool to inform the policymaking process, for example, by helping to map the distribution of disease, but it is less frequently embedded within the policymaking process itself. And finally, we found a relative lack of ethics and equity considerations. In particular, none of the studies we looked at demonstrated commitment to data ownership and sovereignty of participants or communities. Though I learned a lot from this process, one key takeaway for me is that the research process is highly iterative. One example I remember is revising our data charting form to be better suited to the data. So the major significance of this work is that it can support both researchers and policymakers in applying these methods. But there's still significant work to be done. For example, how much value does AI actually add in this context? And can we develop guidelines for the use of ethics and equity in this area? For me personally, I've learned that I'm very interested in this area, and I hope to continue this work and to continue learning about the research process. Thank you very much for listening to my presentation. And again, I just want to thank Dr. Penny, my supervisor, the research team, and the Institute for the opportunity.
Hello, everyone. My name is Sundas, and I'm a Global Health Intern at the Dahdaleh Institute for Global Health Research. In this presentation, I will delve further into the Lending Library project, which I initiated with the supervision of Dr. James Urbinski and Teresa Din during my second year of university. The Lending Library was created with the goal of establishing a valuable resource for individuals interested in global health, such as students, fellows, and researchers. Our focus was on curating a diverse and extensive collection of books and research materials on global health, making it easily accessible. The project has been a rewarding and fulfilling experience, and I am grateful for the opportunity to work with such a dedicated and inspiring team at the Dahdaleh Institute. Today, I look forward to sharing more about this project. So firstly, I'll be talking about some of the tasks I completed during the project. One of the primary tasks was to organize the extensive collection of books belonging to Dr. James Urbinski. I carefully created a detailed inventory of all the books in the collection, including their titles, authors, publication dates, publishers, their conditions, availability, and cover page using a digital tool called Airtable. I also stamped each book with the Dahdaleh Institute logo to ensure easy tracing if they were lost or borrowed. I created a label for each book that included the book's catalog number, which further aided in identifying and locating the book within the lending library. To facilitate convenient access to our collection of books, I implemented a comprehensive system for sorting and storing them. Firstly, I organized the books into various categories that were relevant to global health topics. Next, I identified the main themes and subjects covered in each book and generated a list of descriptive keywords to represent these concepts. I then assigned these keywords to each book using an Airtable database to keep track of them all. Lastly, I implemented an efficient shelving strategy to optimize the utilization of space in our lending library. And finally, as the lending library project progressed, my role evolved to incorporate managing the lending process itself. To achieve this, I designed a comprehensive system for borrowing and returning books on Airtable, which entailed tracking the availability of books, the book loan, and the identity of the borrowers. I also created a sign-out sheet for each shelf. So, what I learned. Throughout my participation in this project, I acquired valuable skills in project management, organization, cataloging, and resource management. This experience allowed me to develop a systematic approach to handling information and materials which will be useful in my future endeavors. Moreover, the project also provided me with a unique opportunity to deepen my understanding of global health and the issues confronting communities worldwide. As I sorted and cataloged the books, I delved into their content and gained a more comprehensive understanding of the innovative solutions and strategies being developed to address these challenges. I was particularly inspired by the passion and dedication of the authors and the researchers whose works were included in the collection. Their contributions reinforce my belief in the process of knowledge and collaboration to drive positive change and make a difference in our world. So for future plans, looking towards the future, we have several plans in store for the lending library at the Dahdaleh Institute. One of our top priorities is to create a web page for the library, which will make it even more accessible and increase its reach beyond our physical location. This web page will feature an online catalog of our resources, enabling users to search and browse the library's collection from anywhere in the world. Additionally, we plan to expand the library with more resources on global health, including new books, journals, and multimedia materials. Before concluding the presentation, I want to express my deep appreciation for the guidance, support, and motivation provided by my supervisors and team during my internship. Their expertise and insights were instrumental in shaping the direction of the project and contributing to its success. I consider the Dahdaleh Institute internship program a valuable learning opportunity, and I am excited to apply the skills and knowledge I acquired during the experience in my future endeavors. Thank you once again for listening to my presentation.
All right. We all set? Okay. Welcome back, everyone. And we are going now to go forward with our 3 presentations for the rest of the afternoon. And just remind everybody, just use the raise your hand function at the bottom of your screen and mute your microphone if you haven't already done so, and we'll take some questions at the end. So our next presenter is Taylor Cargill. Taylor's here in person, which is always great. And she's working with Professor Jude Kong, a mathematician and a fellow here at the Dahdaleh Institute. And she's working with Jude to explore various data science projects as they relate to Canadian and international COVID pandemic response. And the title of Taylor's presentation today is Coordination of COVID-19 Decisions Across Canadian Post-Secondary Schools. So over to you, Taylor.
My name is Taylor Cargill, and I'm a fourth year. My name is Taylor Cargill, and I'm a fourth year biology student in the Department of Science, Faculty of Science, and I've had the pleasure of being in the Kong Lab for the past 2 years through the RAVE program, and also more recently as a Global Health Intern with the Dahdaleh Institute. So I'd like to start off by thanking my supervisor, Dr. Kong, and also thank you very much to the Dahdaleh Institute, everyone here, for having me and allowing me to present today. So I'm just going to start off by giving an overview of the research project, my main research project in the Kong Lab, which was the coordination of decision-making by Canadian post-secondary schools in response to COVID during 2020. So to start off with the background, so when COVID-19 first emerged in 2020 as a pandemic, post-secondary schools in Canada were facing a major challenge in having to navigate all the guidance of public health officials so that they could quickly implement decisions on how they would continue operating in the context of COVID, in terms of like prioritizing the well-being of their student staff communities and also making sure that they're mitigating disease spread. So our research question for this project was essentially we wanted to figure out what are the socio-demographic factors that influence the timing and the outcome of key COVID-19 decisions made by schools in Canada in the post-secondary level in 2020 to prevent disease transmission and to support their communities. So some of the decisions that we were looking at for this project were when did the schools first become seriously alert to the crisis of COVID-19 in 2020? How swift were they in transitioning to online learning and teaching? How did they navigate campus closure? Did they immediately close campus, and then how long did it take for them to reopen? How conscious were they of the need to shut down in-person operations, essentially? Their mask mandates, remote operations, as I mentioned, And then also we wanted to look at how are they supporting their student, staff, faculty communities in that transition? Like, were they offering financial supports for students? Were they supporting mental health, technology access? What were the supports in place to help facilitate the transition, as opposed to just telling people, okay, we're shutting down, and then letting them figure it out for themselves? So for this project, our key milestones have been so far, I've been working with another member of the Kong Lab, Halima Ahmed, on gathering data. We've created a data set of 17 non-pharmaceutical intervention decisions made by the Canadian post-secondary schools. So looked at what decisions they made to facilitate the shutdown and also to support the communities. And we did this for 122 Canadian schools in the post-secondary level, and we were able to publish a preliminary analysis of our data in a journal. The second milestone has been that I recently worked on submitting a proposal to Statistics Canada so that we could request access for covariate data to continue our analysis. We submitted that in March, and we're waiting on hopefully to get access to that data soon. And then thirdly, I've been working with Dr. Kong to form a collaboration with the U.S. research team at GMU in where it is, but we're working with them because they've basically created the foundational study in the U.S., kind of doing similar work in American schools, and we hope to collaborate with them to do kind of an analysis of both countries to see like how post-secondary decision making compared across the countries. Oh, that's the wrong button. So 3 lessons I've learned through this experience. Firstly, it's given me a deeper understanding of the complexity and the importance of effective pandemic responses in the education sector. I didn't know it was this complicated, and learning about kind of like how important it is for schools and for every sector of public and private sector to kind of coordinate and come together on making effective decisions in such a stressful, tight timeline, making sure that they're supporting their people in transitions related to pandemic response at the same time. It's really interesting and a perspective that I didn't have before as a bio student. So that's the first thing. And then secondly, it was my first experience publishing and writing a scientific manuscript and navigating the peer review process, and also it was my first experience submitting a data access proposal. So that was a really useful perspective for me. And then thirdly, with the collaboration with the U.S. team and also just being in the Kong Lab, I've been gaining a lot of experience collaborating and communicating internationally with professionals in global health research, which has also been really valuable to me. So for the next steps of this project, we plan to start off by firstly conducting a literature review that I mentioned before, comparing the factors that drove decision-making in Canada versus the U.S., in partnership with that U.S. team, somewhere in the U.S., I don't know where they are. But, and then secondly, once we hopefully get access to the StatCan data, we're planning to perform a regression analysis to identify the specific factors to pinpoint those factors that influence the timing of decisions. And then lastly, and generally for me, I'm hoping to learn more overall about how data can inform global health and pandemic preparedness, and just how data science in general can be leveraged in decision making and in research. So yeah, thank you to everyone here, and I'd like to thank my supervisor, Dr. Kong, and thank you to everyone at the Dahdaleh Institute for supporting me. Yeah.
That's great. I've got 5 questions for you.
Okay.
But we'll get to them. Our next presenter is LaToya Hinds, and she's presenting virtually. And LaToya is working with me to write and edit the Dahdaleh Institute's weekly and monthly publications. And she's not only working with me, she's working with Teresa, has worked with Shauna, and is working with Fernando and Emma as well. And her presentation is on communication and global health at the Dahdaleh Institute. So over to you, LaToya.
Okay, so communications and global health. So I am now a third-year health studies student, and I have been working under James, but with Teresa, Hannah, on the newsletter. Oop. And there have been, sorry, pushing buttons. So my presentation is just going to focus on some of the highlights of what happened when we talk about the use of language and health and where it takes us. So why communication and health matters. So it brings awareness to critical global health topics. It highlights research initiatives that are currently underway. It increases our links with people in academia and the people in which they serve, which is a huge piece. I think that we're doing a lot of great work here, and being able to share a lot of that work with various groups allows them to have a look into what we're doing, and then allows them to ask any questions. And then also in us being able to speak about the things that we do, it serves as a chance to inspire other readers to be involved. So maybe things that they might not have known about TB or safe water forces them to ask a lot of questions about what they can do to get involved to help make changes. Sorry, there's something happening with my screen. Let's try this again.
That's good.
Okay, so the Dahdaleh internal newsletter. So during my year here, it was initially supposed to be twofold. We were supposed to do the publication, but that evolved into me working on the newsletter, which was great because it was something that really allowed me to look at the different facets of things that are happening at the Dahdaleh Institute. So just a quick recap of what happens with the newsletter. So it comes out weekly to members of the community within Dahdaleh. It features stories that highlight work being done. So research projects, recaps about events that are happening. And it also spotlights publications from our members. So if you've published a journal or written a book, we like to feature all of those things so that you have a moment to showcase all of your work. And it also gives us a chance to read and learn about things that we might not have known prior to. So it's a curated in a clear and concise manner to engage readers and formatted in a way that uses the Dahdaleh standard of practice. So just making sure that we have a standard of font, certain colors, and a layout that is really easy to read and click on as you're going through it. We also have an external newsletter that comes out monthly to people outside of the Dahdaleh community. And it features stories that highlight work that is being done by members in the past month. So it spotlights, again, publications from our members that took place over the last month. So some of the things that we might like to feature is most recently we had a global health student who was talking with Global News about World TB Day. So those are things that we want to highlight and showcase that we are bringing awareness to. So, and then it comes again in a clear and concise manner that is used with the Dahdaleh standard of practice. So very quickly, I just wanted to show you guys, in case anybody hasn't seen it yet, what the internal and the external newsletters look like. Sorry, I'm just going to change this screen that I'm sharing. Okay. So if you can see here, this is our weekly newsletter. For anybody who hasn't seen it, I'm not sure if some of the interns with all of your busy schedules have had a chance to see it yet, but at a high level, this is what it looks like, where we showcase a lot of the events that are taking place, just with some updates and timing, and really gives easy access to be able to be a part of what is happening within Dahdaleh. And then also, if you've missed anything, it is a great way to, again, keep people engaged and knowing what is happening by talking about the recap, showing images, because one of the things when we're talking to people is that it doesn't always come through words. Sometimes you can say a lot with an image. So the imagery that is used is equally as important as the words that are here. So just recaps here. We highlight books, and then we also showcase prior interns who are doing things now, just to show that once you've been with Dahdaleh, any exciting things that are happening, we like to showcase those also. And then reminders that are happening. And one of the best things that I would note, if you're an intern for the newsletter, is the funding opportunities section, where we do take a moment to just kind of like highlight ways in which you can get your research supported and help you on your journey. And lastly, really, really quickly, I will show you the monthly newsletter that just kind of encapsulates everything that has happened within the last month. And showcases a lot of the great work that is being done. And this goes out to external community to hear inside and see what is taking place. And if they want to get involved, how they can do so. Everything has a clickable link. There's opportunities and ways in which you could show how you want to be a part of things. So that's, in a nutshell, what my year was. And I think that this, for me, as somebody who is very much interested in storytelling and making sure that we are engaging with the people that we are serving in a variety of ways beyond the written word, I think that this was a really great way for me to see all the ways in which healthcare tells a story through its research and things of that nature. And that's it.
LaToya, thank you. That was fantastic. That was great. That was great. Our third, I have questions for you, but we're just going to go to our third presenter, and then we'll come back for a couple of questions from myself and from others. The third and final presenter is Yashini. Yashini Ravindran. Sorry, Yashini. And Yashini is working with me and with Teresa to develop a website and support communications tool on the Massive Action Global Health Design Seminar Series. And Yashini is going to do her presentation, which is titled Global Health Sub-Website System Design at the Dahdaleh Institute. So over to you, Yashini.
Okay, great. So hi, everyone. My name is Yashini, and I'm a second-year design student. So my role at the Institute is a research communications and website assistant. And so I'd also like to say my thanks to Dr. Binsky, Teresa, and Shauna for guiding me through the role. And I found it to be a really insightful learning experience. And so, yeah, I'm excited to show what I've worked on this year. Okay. So I was given the task to revamp the subsite manual to make it more accessible for the employees at the Institute. So revamping the subsite manual involved redesigning its layout and organization to make it more user-friendly while adhering to the Institute's branding. So updating existing content and creating new sections were also key tasks to ensure that the manual accurately reflected the subsite's features and changes. Additionally, I integrated some of the new features and tools to help improve the site experience, which was an important aspect, which required documentation for staff members at the Institute to learn how to use these new features. Overall, the project involved enhancing the manual's usability and functionality to help support the staff in their daily work when working with the subsite. So here's like an excerpt of the pages that I created from the manual. Yeah, and so here I was responsible for creating the promotional content for the Massive Action seminar. The seminar is aimed to inspire people to take action and make positive changes in the world by highlighting the power of design and innovation to address global challenges. So knowing this, I decided to base the branding on new perspectives and different approaches and directions on how to approach these problems. So this project has definitely helped widen my skills by understanding the importance of designing a message and how it's crucial in effectively communicating information to an audience. And so these are some of the posters that I've designed. So they were used on all platforms, so like posters and on social media as well. And finally, I also helped design and develop the subsite for the seminar. So with the help from Michelle, we created wireframes and mockups to determine the layout of the site, designing templates, and creating a cohesive visual design that aligns with the seminar's branding. And for creating and managing the site content, I was involved in developing and organizing the site's content, including the text, images, and some of the other media as well, to ensure that it's easy to navigate and find information on the site. And so what I learned is through my experiences of attending the global health seminars and working on some of the projects related to the field, I've come to understand the greater importance of the intersectionality of global health and design. And so the realization has kind of inspired me to apply my UX design skills to the health sector and contribute to the development of innovative digital solutions for pressing global health issues. And so overall, these experiences have taught me the importance of user-centered design and the role of effective collaboration in creating successful outcomes for projects. And so, yeah, so I plan to use my skills to contribute to the design aspect for development of accessible and user-friendly digital solutions for global health issues, particularly for those who have limited access to healthcare resources. And so, yeah, thank you everyone to listening for my presentation.
That's great, Yashini. Wonderful. So I just encourage people to raise their hand online if they have questions. And also in person in the room, if you have any questions, you're very welcome to pose those. Yashini, I'll just, you're online, where are you? There you are. Just ask you, Yashini, just watching your journey over the year, I'd just ask you to reflect on just the relationship between the utility of information. So how useful is it to a user and the presentation of that information? So, and the access, how is the design of the architecture of a website, how is that so important to how useful an information can be? Can you just kind of reflect on that a little bit?
Yeah, so I actually took a course just recently on information design, and I think that kind of helped make me realize wait, could you just reiterate your question again? I just want to make sure I'm pinpointing the right response.
Yeah, just the architecture of how information is structured and presented, for example, on a website, and how that is so important to how useful the information is.
Right. Okay. So yeah, I know one of the things that just came up to me is having the users engage with the information as well. I feel that's a really important aspect to having the information accessible to everyone. So when they're engaged, they're able to listen and understand way better than having to just view the information just as itself. So I think having interactive elements forums and stuff, trying to interact in that way for information would be a great way to do that.
And then the other thing I just ask you to kind of reflect on is and I just say this really as a compliment. I mean, the work that you did on the poster design, especially, I just found it extraordinarily beautiful and very simple, very elegant, very inviting. You know, so when I look at those posters, I want to look at the poster. I want to read more. I want to go into it and go, oh, what's this? What's that? What's that? Whereas I look at other posters for many other things, and you think, oh, I don't even want to look at it. It hurts my eyes. You know, it makes me confused. So, could you just reflect on your experience as a growing designer, as a person who's learned a lot about how to do that? What is the kind of, is there a core idea that for you has guided you over the last, on that journey of kind of creating things in a beautiful, simple, elegant way?
Mm-hmm. So like, I think I briefly mentioned that I also like, from doing that project itself, was the importance of like the message behind for what you're creating for. You want to be able to make sure it's it reaches a really wide audience, so it's really easy to understand what the message behind of what the work that you're doing for is. But yeah, that's kind of what drove me into, I guess, like that's my way of like designing things. Like that's what makes me move forward that way. Mm-hmm. Great.
And then if we look at the manual that you designed and wrote, it's a very different process, right? It's not it's not so much a visual, but it's a very detailed and yet, well, it's a different process, but there are similarities. What are the similarities? Like, what are the key principles that apply in, for example, designing a poster and designing a manual for subsite use and development? Are there common principles?
If I had to think of some, like when I was creating the subsite itself, like I tried to emphasize the importance of like layout and organization. You want to make sure that certain elements of the like information is better seen than others. So that's what I try to emphasize on when I do design as well. It's like there's some information that should be prioritized compared to others, and that was also used when creating the subsite manual as well.
That's great. Well, thank you so much, Yashini, and I will again just thank you for all the work you did over the year on the subsite manual, and also supporting the Massive Action Global Health Design process with your just truly beautiful work. So thank you so much.
Thank you.
I just have I have tons of questions for LaToya, but the one that I would just kind of hone in on right now, you talked a lot about the presentation of a story, right? That a story is not only about words. Words are very important, and you said that several times, that the use of language is extremely important, and I really very much agree with you. But one of the things that you also said was that stories are about a lot more than language, right? They're about the visual presentation, they're about the image, they're about the flow, for example, of a newsletter, of the flow of a document. They're about many, many different elements. Do you want to just talk a little bit more about that?
Yeah, so one of the biggest things that I think to me when I'm talking about flow is that it's twofold, in that we have a flow within academia that kind of like flows in a certain way, and we have certain language that we use. But over the years, we're starting to shift and realize that there's more than one way to tell a message. And if we're going to get the great work that we're doing across to people who are not necessarily within academia, we have to consider using other methods to tell our story, whether it's with a documentary, a podcast, a series of images in a certain order that tell a story. I think that when we're trying to, especially in this space of global health, because we're talking to so many different people from so many different cultures, and the way in which they receive different types of messages won't be the same. So I think it's just necessary to look at all of those things.
So one thing that I also wanted to ask you about was, or just to, first of all, compliment you on, just the beautiful flow of the newsletters. Like, they're really, really good, and they're very inviting. Can you talk a little bit about how you created that and how you actually thought about the design, if you will, of the story in the newsletter?
I think one of the biggest things is, for me, is that people have a voice. When you're doing great work, you have a voice and you should be able to tell that. So in my mind, when I'm looking at a book that is being written, or if one of our members has been featured within the news, it's always important to me to take a piece of what they said or the cover of that book and include that, because that pulls you in such a way that where if we're looking at the cover of a book, well, now we're talking about the theory of color and the fact that color brings in different thoughts, emotions, and all of those things. And even when we're talking about an interview, I can write down, well, so-and-so was talking or had an interview about TB Day, but it's very different to hear the words of a fourth-year global health student talk so passionately about global health, and to let her speak for herself, because what she's doing is she's speaking to not only us, but her peers at that same level. And they can kind of see, well, like, she's out here, she's doing this work at fourth year, and that this is what those thoughts are.
That's great. And I know you're in your third year now, and what are you thinking about for the future?
So for the future coming up, I'm actually preparing for graduate studies this summer. I actually sit on a few boards for health that I'm going to be working on more intensively over the summer, specifically about the community health aspect of health here in Canada, with Indigenous groups and Black groups, to talk about how we can get the message out and how we need to talk about things in a way that is tangible and sustainable and kind of crosses all sectors. I'm also working on a documentary. There's a few things that are coming up. And I'm starting to take a dive into medical anthropology, because I do think that it is important to understand the culture of medicine before, to kind of guide my future.
That's great. I'll come back. Oh, go ahead, Michelle. I'll come back to you, LaToya, in a second. Go ahead, Michelle.
Oh, I just wanted to say, I really enjoy reading the newsletters. I think they are so well laid out. Like, from a design perspective, and kind of talking about what Yashini's been saying with the informational architecture, all the headings, you'll find everything you need. I always know every time I open it, it's oh, they tell you when the institute's open. I haven't been coming in, but I know that it's open Monday to Friday, 9 to 4. I love that. That's the most important thing. And then I see everything else from the past week. So it's fantastic. And just seeing the difference between the internal and external, it's really professional and shows all of the work of that's being done here and how amazing it is, and just showcasing that in such a beautiful, well laid out way. So yeah.
Yeah, to that I will say, the leaders that I had working with me have been amazing. So working with Hannah, and Teresa and Shauna has been amazing because they've forced me to also think about things from a different lens and how things could even be like worded a bit better and simplified, because sometimes when I'm writing, I get really like flowery and passionate about like these like stories that I'm reading. And when I talk to Teresa, it's always like, okay, concise, like a little bit more. So I'm super thankful to her to really be able to have taught me the importance of telling a really good story in a few words, or not a few words, but a more succinct way that really grabs people in. That is like hands down one of the biggest things that I'm thankful for.
Great. Taylor, thank you for your presentation. And I'll just say that Jude, Professor Kong has arrived, and I know Taylor has had a great experience working with Jude. But I will just say that Jude received last week the University President's Research Leadership Award. It's the top award within the university. It speaks to just how just brilliant this man is, and to the work that he's leading, and to the team that he's created. And Taylor is a member of that team. And Jude, I don't know if you heard her presentation as you were coming over, but Taylor did a fantastic presentation. And she was, I'm just going to ask you a couple of questions about it. You talked about looking at COVID response in post-secondary schools across the country, and 122, I think you mentioned, 122 schools. Now, were those schools in different provinces, or were they all in one province?
Across Canada. So we captured, I believe, 12 provinces and territories. I think the only one we missed was Yukon.
Yukon, because it's so small. Yeah.
But we all across.
And so did you see differences in the integration strategy of public health responses in post-secondary schools? Did you see provincial differences?
Yeah, so we did see some provincial differences. So we saw some differences across the provinces. I can't remember the specifics right now, but generally the places like Ontario, BC, like there were clusters of similarities in the response for certain decisions, and it was kind of, I guess I could say, there were certain decisions where it was kind of the same across all the provinces. Like, for example, moving online, transitioning to remote learning, they kind of all had the same timing on that, or a similar timing, like right at the start of March when the pandemic started. But then there was variability in other possibly less guided decisions, like implementing mask mandates was pretty variable across provinces, and whether or not they decided to continue staying remote in the fall and winter, the upcoming semesters, varied differently. So hopefully, like once we get access to the StatCan data, we'll be able to dive deeper into the reasons why it was different. But yeah.
So I know this is anathema to any kind of researcher. You're not supposed to do this, but let's do it. Can you speculate as to why there were such differences across provinces?
Yeah, so some of the factors that we're hoping to look into are governance style, like the political affiliation, like the university affiliations, and also we're hoping to look at factors like diversity of the institution, case prevalence in the area. We're speculating into a lot of different factors, and hopefully once we can dig deeper, we'll know more. But yeah, that's kind of...
That's great. Now, are you going to be part of that research?
Hopefully.
I must add that, but I want to thank you, James, for the award I won, thanks to the support I got from the Institute. So it's like the Institute put structures to get you there, and then they tell and tag me and congratulate me. when they meet me, who I am, so you projected their data into me. What Taylor has done is brilliant. She has published a paper. So the paper is published in Frontiers of Public Health, and she's now moving to look at those factors. I must say that people read the paper, and we got collaborators reaching out to us to collaborate with us from the US to compare US data and Canadian data. So Taylor currently is working with a team from US, comparing the US data, the US situation, and Canadian situation.
So just as a suggestion, it might be very helpful as you go forward with defining that research agenda to actually assemble a very small group of thinkers and from a transdisciplinary perspective to look at that data and really just to kind of pose questions around what might be some of the causal factors at play, because the value of data is that it's like all what we've heard from LaToya, what we've heard from Michelle, what we've heard from Yashini. These are all like truly brilliant design people, and what we've heard from them is the importance of the story, right? That the story is in the data. You just have to find it, right? It's kind of like a doctor, a doctor, when a patient comes to a doctor, the job of the doctor is not to tell the person what's wrong. The job of the doctor is to listen and to discover the story, right? And what they teach you in medical school is that it's not about tests and investigations and surgeries and so on as a way of understanding the problem. The most important thing when you're trying to make a diagnosis is to listen to the patient, because they will tell you the story. Your job is to take all the knowledge that you have, all the data that you have about the causes of diseases and so on, and to somehow find the story. Find the disease in the story so that you're able then to help that person. So if you just take that idea and sort of apply it to all of the incredible things that we've heard today, design is about process, right? It's about telling a story. It's about telling a story that people can find themselves in, right? It's about creating a vision of something, and in our case, global health, in many very practical kind of project applications. So, and then the health component, the global health research component, is all about the science, right? Which is what you're incredibly good at. Just listening to you, you know what you're doing. It's all about taking the science and finding the data that tells the story, right? So there's a kind of a relationship between the story and the data. There's always a story in the data, and the challenge is to find the story. And if you're only looking at just looking at the color or the data points, the numbers, and you're not thinking about the story, well, you're missing the opportunity. Just like if a doctor, when he's talking to a patient, if the only thing that he's interested in is the heart rate or the blood pressure or whatever, he's missing the story, right? He's missing the key thing is the story, and how can I apply my science to help that person live better with that particular disease or live in a better way with that particular story. So there's a really big relationship, and that's kind of what we're trying to do at the Institute. And we've kind of learned over the last 4 to 5 years that those two things, the story and the science, they really matter. And we're trying to, this year we've been particularly lucky with our Massive Action Global Health Design seminar series, and taking that series as an opportunity to apply design principles to very specific case studies. And Jude's AI for PEP program, Artificial Intelligence for Pandemic and Epidemic Preparedness and Response program, which is now a global program, by the way, was one of the case studies. So that's a very, very, for me, a really powerful lesson, that I've been listening to you, listening to all the people today, the relationship between design and global health. There really is a very important relationship to the story and data, right? What is the story and what's the vision? What is the story that we tell about ourselves, about global health, and how do we find ourselves in that story and create good, solid, better global health interventions? So I've been very, very impressed. And Taylor, I have one more question for you. You talked a little bit about the experience of publishing. What was that like? What did you learn from that?
I was completely new to it, so it was my first time. I guess my main takeaway is being able to show your work to Dr. Kong and get feedback beforehand, and basically like asking for help and like starting with the draft and then connecting with other people and trying to get feedback on the work so that it's the highest quality that it can be, and then knowing that there's always room for improvement, because of course the reviewers will always have suggestions, and learning how you can make sure that your science is rigorous and is the best quality possible. Yeah.
What about the process? I think many people have had a lot of experience. All of the speakers today have had some experience with understanding, how complicated actually research is, how complicated administration is, and yet how necessary it is. Did you have any experience there? Is that something that you've experienced?
I'd say yes, in the sense of understanding how complicated the decision-making process was for schools. Never before did it occur to me like how much they had to juggle at the onset of the pandemic, trying to make sure that everything continued functioning, and that was really like a mind-blowing perspective for me, like how much they had to deal with, how many different factors they had to consider: the safety of their students, the safety of their faculty, maintaining faculty, like remote work operations, and also considering the health of students and staff, the mental health, financial support, community support. They had to take in a lot all at once in that kind of such a major shift that COVID created. So it was just a huge challenge that they faced, and learning how complex it was, and how figuring out what influenced those decisions can basically help improve the future, so that if it happens again, schools are better prepared and they can learn from the data or like the decisions that they made in the past. That's kind of been my takeaway.
And I'm sorry to put you on the spot, but you had so many great comments in your presentation. You talked about coordination, realizing how important coordination was between various actors to come up with clear decisions. As you were talking, I thought, wow, it's actually a really important insight. And also that insight led me to think, well, you can coordinate, and you need to create structures so that people can coordinate more effectively. But people can only coordinate if they have a common understanding, right? If they actually understand an issue in the same way, right? So if I'm sitting over here and I need to coordinate with the person over here, well, we can figure out, we can give them a map, say, well, if you drive this way, you can meet here, and you drive this way, you can meet there. That's a coordination mechanism. But if I don't have the same understanding, if I want this person to coordinate with this person, and this person wants to go, to the mountain, and this person wants to go to the ocean, well, we have different goals, right? So I can give them a map, but if they want to go to different places, that's not particularly helpful. So in an emergency, and this is more a question for Jude than for you, in an emergency situation, like a pandemic, the science was evolving literally on an hourly, daily basis and globally. It wasn't just in one place, right? So the science was constantly changing, and therefore the understanding is constantly changing. Do you have any insights around the sharing, if you will, and the sharing of a scientific process? And what were some of the challenges that you saw in creating that common understanding at different times, because it was constantly changing around different issues, but creating that common understanding so that coordination can be more effective? Do you have any thoughts or reflections on that?
Yeah, I do. I thought a lot about this, and it's not. One thing that was very important and may have created a lot of problems was communication, different messaging at different points. The value of, it was very essential to have contradictory information. When we talked a lot about a group of students, be it students or people in communities, reacting differently, maybe to vaccine or different policies that were put in place, the idea, the problem there was on communication. And we realized that at that particular moment, because this was a new virus, we were trying messaging time upon time, and then people got confused with the messaging and felt otherwise and didn't respect whatever was coming on after. But we have coordinated our messaging, which was difficult. It was a difficult balance to strike at that particular moment, given that nobody knew what was going to happen at this particular time. But if messaging was coordinated and people got the same message consistently amplified, people would have respected the policies that were put in place. So this is what I thought that I've learned throughout these, be it on campus, the work that Tieu have done, be it the work that we have done within communities, the Black Creek community and across Canada with Global South. The problem was about messaging. When you stand on a vaccine and say, oh, this is really good, and then the next time you said, oh no, we don't find that this effective, and then you send that same vaccine to a group of people, people feel that, okay, if it's not good for you, why should we have it? And then you come to them and you're saying, you need to have this. Meanwhile, in your own country or in your community, it's not good. So that messaging was a problem, and people tend not to trust policymakers.
Wow. Simran, do you have any thoughts? None. Okay. Any other thoughts or questions from anyone online? Okay, well, that's great. We're just 1 minute to go, which is unfortunate, but I just want to say to everyone again, thank you for a great year, and thank you for a great symposium. It's, as I said at the beginning, it's always, for me, this is just one of the highlights of the year. I love to see how students have grown and how they've progressed over the year. And it's just so obvious that this has been such a great experience for everyone that has presented today. The learning, the growth, the development, contribution to their ideas of what's possible for them in their lives and in their careers is just great. And with that, I would just like to wish everyone the very best for their future, and tell you that you're always welcome here. If you want to come to a seminar, if you want to, either online or in person, as Global Health Interns, you are now officially alumni, and you are always welcome here. And not just to kind of observe, but if you want to participate, if you want to bring new ideas or new approaches, or you have new things you want to investigate, you're very welcome. And with that, I will just close by saying that a great program, a Global Health Internship program, never happens without great administration and support. And what we've seen from Teresa, what we've seen from Fernando, from Shauna, and from Emma is not only great administration and support, we've seen real teaching, right? Real engagement, real support for experiential learning, and real vision and real kind of commitment to what global health is all about. And I want to just again thank Teresa. I want to thank Emma. I want to thank Fernando, Armando, who's no longer with us, and also Shauna for all of their incredible administration, support, and most importantly, teaching and vision. And with that, I will now declare the symposium over. Thank you.